Hi, my name is Shaylin Klinger, and today I will be doing a case study role play with an individual that has been diagnosed with post-traumatic stress disorder. In the DSM, PTSD criteria for diagnosis includes death, threatened death, actual or threatened serious injury, or actual or threatened sexual violence. The traumatic event itself is persistently re-experienced either through dreams or flashbacks, and then the individual in this particular case is having nightmares and flashbacks, and then avoiding trauma-related stimuli after the trauma. So any of the events that may be triggers for them, whether that's going into a small space or even a crowded room with multiple people, driving in vehicles, those things may get worse after they've experienced the trauma. In addition, the symptoms must last for more than 1 month, create distress or functional issues within their daily life, and aren't directly related to things like medication, substance abuse, or other illness. So one of the things that I'll be working with in this role play is practicing cognitive therapy. So cognitive therapy is really the belief that our thoughts and feelings are what impact our actions and our behaviors. So basically we are developing habits of thinking that form the basis of our screening and coding of our environmental input, categorizing and evaluating our experience, and then making judgment upon how we behave. So basically our behavior isn't a direct result of thoughtful choices that we are making. This therapy is one of the best therapies for individuals that have post-traumatic stress disorder. And it's important to know that it's really important to make sure that you're doing this with an individual that's able to think abstractly about their own thought processes. So this would not work for somebody that has, perhaps a traumatic brain injury on top of post-traumatic stress disorder if they're not able to think abstractly. So my role in this is really going to be kind of as the educator that's going to be working with the individual to kind of have a conversation and draw attention to their own thought processes. So I'll be working as a sounding board and as a guide. I'm going to be listening for opportunities to identify and correct some of these cognitive distortions they may be having. And in particular, I want to make sure that the relationship I'm developing with my client is going to be a collaborative one. So one where they feel like they can set goals and I'm going to help them reach them. I also need to make sure that if I have any personal biases, I've kept this in check, and I can do that through supervision, and I'm just kind of revealing and reviewing my own feelings after each session also. So the structure you'll see in this is that what I'm going to really be doing is you'll see like kind of an initial meeting. So I'll be doing a mood check. I'm going to talk about the presenting problem itself. I'm going to look at setting goals with the individual, so I want to make sure that they feel like they really bought into the therapy and they're owning it. I want to make sure that I educate them about what the cognitive model is, and I want to make sure that I understand what their expectations for therapy are as well. At the end, I'll provide a summary of our meeting and then ask for session feedback from the client themselves. The goal really is going to be looking at cognitive restructuring and cognitive coping and problem solving so they can then develop their own healthy coping skill mechanisms. Typically, a session is going to last between 50 and 60 minutes. I'll suggest weekly appointments, but again, for this, we'll just do a 10-15 minute session here. I'll suggest too and ask the client to make sure that I get buy-in that they are willing to come at least for 6 sessions, just to kind of get that buy-in and get that encouragement that they're developing a relationship with me and they want to make sure that they're getting help. I'll use some concrete steps too, looking at the core beliefs by asking leading questions. So what were you thinking when, or what did it mean to you? And I'm going to try to really pinpoint some of these cognitive distortions or things that they're thinking so they can understand why they're feeling the way they're feeling. I also am going to use some imagery as well and try to role play targeting maybe perhaps one of the flashbacks or anxiety-provoking situations that they're in. So Thank you. Hi, I'm Shaylin. Thanks for coming in.
Hello, I'm Michael.
Nice to meet you, Michael. I heard that your primary care physician referred you to come speak to me. Do you want to talk to me a bit about that and who you are and why you're here?
Yes, I was in the Marine Corps for 4 years.
Okay.
I was deployed 3 times to Iraq and Afghanistan. Most of those, the first 2 deployments, I'll say it went smooth, but we got through them. The third deployment, I was in a convoy, and the convoy was struck by an IED blast. More specifically, me and being 4 of my friends were in a Humvee about 2/3 way through the convoy, and the IED blast is about halfway through the convoy, so it struck a lot of people. We're kind of on the outskirts of the vehicles that were affected. However, 2 of my friends, my fellow Marines in the Humvee with me, unfortunately passed away due to their injuries.
Oh, I'm sorry.
I was severely injured, but not enough really to be medically evac'd out right away. It's about 3 weeks later I was evac'd out. We lost a lot of people that day. It was a bad attack, and being a Marine, I kind of try to suck it up and get over it. But I think it affected me more than I thought I knew it did. My wife is mentioned to me that sometimes I have mood swings, and I get aggravated, and I really don't even realize I'm doing it. I'm during like big crowds. Obviously, loud noises and explosions or like fireworks or whatever.
Fireworks, yeah.
It just kind of puts me right back in that situation. A lot of times I don't even realize what I'm doing. I'm just back in that in that environment. So I don't want to something bad happen. So I'm trying to get ahead of the situation. So I went to the VA. They recommended that I get some counseling and help. So talk to them about it. I'm usually a very quiet person. I usually don't talk about stuff, so I kind of internalize everything.
Sure. Well, do you mind? I'm writing a few notes down here, so you'll see me writing because I just don't want to miss anything. That was really heavy stuff that you shared with me, so I just want to tell you thank you for sharing with me. How are you feeling right now after you just talked about that?
Right now, it's kind of really surreal. I feel a little bit of weight been lifted off me because like I said, I don't really share that information with a lot of people. Most of my fellow Marines that I served with, they know all stuff. A lot of them don't talk about it either.
Got it, right.
But it is kind of easier to talk to someone who I guess I'm not affiliated with, or someone I'm not. I know that can judge me.
Right, kind of an unbiased point of view, absolutely. Well, let me talk to you a bit. I definitely want to go into this with you, but I do want to talk to you a bit about what my job is and what I'm going to be doing here to make sure that this is a good fit for you, and we're making sure that the therapy that we're going to be working on is something that you have buy-in to, because I really firmly believe that if it's not a good fit for you and you don't believe in what we're doing in here, that it's not going to work. So one of the things I want to do is talk to you about cognitive behavior therapy. And what that is that basically we're going to be working on kind of changing the way you think. So we're going to draw attention to your thoughts, and then draw attention to your feelings about your thoughts, and then work on making sure that those are in line with one another, right? So
so basically, if I understand that right, you're going to catch my triggers, and rather than that trigger sending me back to Afghanistan or Iraq, it helps me deal with it and realize what's going on.
Right. So we call them cognitive distortions in therapy, but things that might just be a little bit off in the thought process. I want to make sure I understand where those are coming from and kind of find other ways to help you get out of that. And that could be through meditation or deep breathing or just kind of closing your eyes, but mostly it's just bringing attention to your feelings and thoughts first. Does that sound like something that you might be willing to try?
Yes, I'll try anything.
What are your expectations for therapy? So let's talk about maybe some of your goals. What are you hoping to get out of this?
Obviously, dealing with the most, I guess, stressful or the most dangerous aspect of my condition. When I lose touch of where I am or whatever, I don't want to be put in a place where someone who I know or just anybody in general tries to help me, and I think that there's somebody else, and they might get sick. I might think they're trying to hurt me.
Hurt you, sure.
So I don't want to hurt them, not knowing, just be disoriented and not know where I'm at. So something like that.
How often do you say that happens?
I'm more at first. I think it happened a lot. I drink a lot, and I used to try and mask it and deal with it my own way. But then, obviously that puts me in bars, a lot of situations, and stuff I can't control.
Absolutely.
So it happened a lot initially. I think now, I won't say I have a better control of it. I'm more aware of, like you said, the triggers and stuff that send me to that place. So I would say roughly 2 to 3 times a month.
Okay. So that's great to have a good baseline, so we know what we're starting with and then where we're working and hoping to go. So maybe an initial goal would be to drop that by half. So maybe, if you're having these things 2 to 3 times a month, these kind of out of body, kind of out of place experiences, we want to drop those down to 1 to 2 times a month, so we can make sure that we're really gauging and we're seeing some progress. I also heard you say that you maybe had developed some unhealthy coping skills through drinking, right? So would you feel that an appropriate goal would be to develop some healthy coping mechanisms, whether that be, and you're talking about meditation or going to the gym, or we can explore some of those options that might be a good fit for you? Okay. And then I hear you use the word trigger a lot, so I do want to review that with you. Are there any certain situations specifically that you find that are triggering for you? Like, is it getting in cars? Is that difficult? Riding in? You're saying it's a vehicle.
I think, yes. I don't know if you've ever been, I don't know what your history is, but if you're in the military when you're deployed or something like that with an adversary uses IEDs and the way they do, they try and grab the convoys. So whenever you're over here, you're always on a state of high alert. You're always you're almost like a robot. Even relaxing, you're on high alert, looking for, I won't say triggers or indicators that something might be danger.
So you're always scanning the environment.
And once you are surprised in that, it kind of sends your world into a frenzy because you think you're not necessarily safe, but you're on alert. Everything's is going supposedly how you dictate it to go, and all of a sudden that's kind of taken from you, and I guess you're ambushed. So that kind of gets you a false insecurity, and not necessarily or back here in the stateside. I would relate it to if you're in traffic and you're really stressed or something you got to think a lot on the fly really quick, and then you have a lot of commotion and people honking the horns or whatever. You got to think on the fly. I think for me that's a trigger.
Well, and we're in the Northern Virginia area, so traffic is always terrible here. So that must be really hard for you then, because you could plan to go in a time where it's typically not like rush hour and then run into traffic. And is that an issue for you then?
It is, and I mostly try and work nights just because of that, trying to stay out of traffic. Of course, it doesn't help me. I can't really sleep. It's great. I don't know if that's really. I'll say it's a combination of working nights, but I'm used to working weird shifts, so I don't necessarily think it's just night shift. I think also the I guess the nightmares or events or whatever keep coming in and haunting me. And I keep thinking about it. Just anything that makes me piss me back in there, or whether it's like an incident from the earlier day or maybe a TV show or a movie or just hearing people arguing or something like that, or just loud noise in general, can also send me back thinking about that. Not necessarily send me in those quote unquote blackout experiences, but it just makes me think about it.
So I heard you say that you're having some nightmares.